COVID-19, which was initially discovered in 2020, has been the deadliest of pandemics in the 21st century. By 23rd December 2022, the World Health Organization had recorded over 650 million confirmed cases of COVID-19, including 6.7 million deaths. In addition to the millions of lives claimed by the pandemic, the socio-economic impact of the disease has been devastating, and the southern part of Africa was not spared.
Before COVID-19, business was quite busy, and COVID had an impact in the cross-border trading, especially on the passengers, in the way they do their businesses. In that, for example, the number of passengers who used to cross reduced drastically, because most of them they used to go and import things, for example, from South Africa and bring in them by bus. But then when the COVID came in, the number of passengers who were going to import things and bringing them by bus reduced.
The COVID-19 pandemic had forced several border points across the SADC region to close or streamline their operations due to inadequate wash facilities to help minimize the spread of COVID-19.
If you must know, Chirundu, I think the time that the pandemic hit was the only border that was actually mostly running and operating in terms of allowing and accessing trucks from different countries to cross and transit through and do the final importations here in Zambia.
The Southern African Development Community Secretariat, in collaboration with the governments of Zambia, Zimbabwe, Malawi, and Tanzania, installed portable hand-washing facilities to help reduce the spread of COVID-19 and other communicable diseases such as cholera among thousands of commuters across the two border posts daily.
Pameza kapa bola wash box na matenda yenze mbili because there's kudia na dot manja but apa manja awe na matenda apa kulipa mwa bana tetera ka uchani wash box
mune zeri kudala inga corona bantu zishita wakati vakudia ngonga like mafriti azibwanje vakudia that washing their hands so when tetera ko government within tivera mushe vatima bauza kwa kasameni kwani kumanja kai manzi ni free bonse.
The benefits of the SADC wash box behind me are that it incorporates a number of people to wash their hands at the same time. It also caters for disabled people to be able to access the wash box.
The SADC COVID-19 Wash Border Post Response Project has been implemented by the Global Water Partnership Southern Africa on behalf of the SADC Secretariat.
In terms of the SADC WASH COVID Response 19 project, which is much more critical, which is a critical project for the region in terms of reducing the spread of diseases across and between borders in order to facilitate free movement of people across those borders. The main objective of this particular project is to reduce the level of risk in terms of pandemic across a number of SADC border to strengthen regional integrations and also to promote hand-washing measures.
SADC has installed the hand-washing facilities under the SADC COVID-19 Wash Border Post Response Project, which is funded by the Federal Ministry for Economic Cooperation and Development through the Douche Gesellschaft für internationale Zusammenarbeit, GIZ.
This COVID wash box solution, the project, we have already improved the standard at border posts where the wash boxes have been installed. And I think that's very important because we are not talking only about impacts in terms of large interventions through pandemics like COVID-19 or now the recent cholera outbreak, but water and basic sanitation is a human right. And at border posts where we have a lot of people working and transferring through, we need a high standard of hygiene, and this has already been achieved through the projects, and we hope that of course this will be also then happen in other places.
It is therefore hoped that through the SADC COVID-19 Wash Border Post Response Project, that there will be minimal disruptions to regional cooperation owing to improved sanitation and hygiene at points of entry.